Hello everyone. Let's continue the 2021 anatomy paper. 11th question. At which level does the nerve supply of the marked structure arise? First we have to know what they have marked. That is the medial rectus. What is the nerve supply of medial rectus? It is a oculomotor nerve. But they are asking at which level does the nerve supply for a marked structure arise? They are asking the level at which it arises. It is in the superior colliculus, which is very close to the red nucleus. Nucleus situated at the level of superior colliculus. It is close to the red nucleus. So answer here is A. 12th one. Through which of the following marked site does SARS-CoV-19 spread to the brain? This 2021 paper, many of the questions were from the COVID-19. Yes. Now they are asking COVID-19 spreads through which area? So we all know it's by the nasal roots, and the which nerve carries it? It is through the cribriform plate, where which nerve is present? It is a olfactory bulb. So A is the marked area from where it spreads to the brain. Okay. Other structure, if you want to see, this is they have marked. This is the cranial nerve 1, that is olfactory nerve. Then this is the optic nerve. It forms a optic chiasma here. This is the oculomotor nerve. This we saw, isn't it? Oculomotor nerve in the previous question. Next, trochlear nerve, that is the fourth cranial nerve, very thin nerve. This is the trigeminal nerve. This is the abducent nerve. This is the facial nerve, and by the side of it there is a vestibulocochlear nerve, that is eighth nerve. This is the vagus nerve, and medial to it is the hypoglossal nerve. This is the so many branches spinal accessory nerve. This small nerve is the glossopharyngeal nerve. Okay. Coming to the next question, 13th one. The fibers from the marked structure ends in which of the following area of the thalamus? They have marked this small structure round, that is the mammillary body. The fibers from mammillary body goes and ends in the thalamus. That is, yes, thalamus. But they are asking which nucleus? That is the anterior nucleus of the thalamus. See, the fibers from the mammillary body ends in the anterior nucleus of the thalamus by the mammillothalamic tract. Here one very nice circuit you have to remember. It's important for us. Yes, Pape's circuit. This is for the memory and the emotion. This is the circuit, isn't it? Let's start with the hippocampus. Hippocampus, this question they have asked many a times. That is, they will mark a fornix and they will ask the fibers will arise from which structure? That is from the hippocampus. The hippocampus will give information to the fornix, from fornix to the mammillary body, and from mammillary body the information will go to the anterior nucleus of the thalamus. Then it goes to the cingulate gyrus, again hippocampus. Why hippocampus is required? It will convert the short term memory to the long term memory. So any new long term memory, if you want to make, hippocampus is very important. If any injury to the hippocampus, there will be loss in new long-term memories. Okay. Then for next, mammillary body is required for a recollective memory. In alcoholic patient, there is degeneration of the mammillary body and they will not have a recollective memory. And anterior nucleus will be required for recent memories. Recent memories are very, if you want to remember something recently, that means anterior nucleus of the thalamus is important. Okay, all this circuit should be good enough to have a good memory. 13th one, C option. 14th one, the parasagittal section of the abdomen is given below. What is the superior border of the marked structure? Here they have marked this small tiny structure, that is the epiploic foramen. The superior border, here only you can see. What is this? This is the liver. But here only one option liver is there. That is the caudate lobe of the liver, as that is the option. Here they have asked the superior border, isn't it? Superior border is what is superior to that foramen, that is the caudate lobe of the liver. And so this question was asked previously also. Previous year also this question was asked. So this is the very important. The superior border is by the caudate lobe, and this is the anterior boundaries. Okay, anterior boundaries, that is portal vein, hepatic artery and bile duct. These are the actually the content of the epiploic foramen. It is also called as foramen of Winslow. The inferior boundary is the first part of the duodenum. Here you can see this is the lesser omentum, and this is the small intestine. This is the lesser sac. This is the greater omentum. This is the supracolic compartment, and this is the inferior colic compartment. Okay, 14th one done. 15th one. A woman with a right-sided loss of sensation of both the upper and lower limb complains of shooting pain from her fingers to the right shoulder and a burning sensation when touching cold water. Motor functions are normal. That means she has a sensory problem, but motor functions are normal. Which of the following structure is likely involved? Here, typically, they have mentioned sensory, and it is a one-sided, that is hemisensory loss, and severe excruciating pain is suggestive of thalamic syndrome. Okay, here you have to guess which one is the thalamus. That is, A is thalamus here. Okay, A. So option A is the answer. Hemisensory loss and severe excruciating pain of the affected area suggestive of thalamic pain, also known as Dejerin-Rossi syndrome. Here D is the fifth one, that is fornix. A is the thalamus and C is the mammillary body. Mammillary body degeneration, when it will happen? In the alcoholics. Yes. B is the cerebellum. So here its option is A, that is thalamus. 16th one. What is the most common complication of the central line insertion below the marked area? Here they have marked the clavicle. If you insert below the clavicle area, the arterial puncture is the most common complication. Okay. Arterial puncture. The left clavicle, the most common complication of the central line below the clavicle is arterial puncture. Which one is the life-threatening complication? If they have asked, then it is a cardiac tamponade. The complication, other complications, pneumothorax is more common in subclavian vein catheterization. Chylothorax can occur, but it is very rare. And thromboembolism more common in the femoral veins, and infections. Injury to the nerve like brachial plexus, phrenic nerve, vocal cords can occur, but it's all very rare. Which is the most common? That is the arterial puncture. So here option is A. 17th one. The marked structure develops from which of the following structure? Here they have marked azygous vein. I'll teach how to draw. Take one paper and pen. It will be helpful. First, let's see the explanation, then come to the answer. Draw two lines parallel to each other, this and this. This is the cardinal vein, one cardinal vein, and this is the another cardinal vein. This and anterior is anterior cardinal vein and posterior is posterior cardinal vein. This is also anterior cardinal vein and this is posterior cardinal vein. Right side is a right anterior cardinal vein, left is a left anterior cardinal vein, right posterior cardinal vein, and this side is the posterior cardinal vein. Okay, this much you have to know. Let's start. First one is a brachiocephalic vein. Brachiocephalic vein develops from the first, draw one small line, that is from the right anterior cardinal vein. Okay, but left develops from the left is very long. Okay, that left develops from the left anterior cardinal vein and the one of the oblique anastomosis. These two together forms a left brachiocephalic vein. Okay, next coming to the superior vena cava, it develops from the what is this? This is the right anterior cardinal vein and this is the right common cardinal vein. These two together forms a superior vena cava, but left common cardinal vein will disappear. Okay. Okay. Now you have to draw two veins extra. That is, one is directly attached to the cardinal vein. This is the supracardinal vein, and this above this is the subcardinal vein. See, this is the subcardinal vein. Here also you have to draw subcardinal vein and supracardinal vein. Okay. Now let's see inferior vena cava. Inferior vena cava develops from right posterior cardinal vein, then little bit of the supracardinal vein, then anastomosis with the subcardinal vein, then it will be this, or everything is a subcardinal vein only. This supracardinal vein and anastomosis with the subcardinal vein, this all together forms a inferior vena cava. Azygous vein develops from supracardinal vein. This is the supracardinal vein and it is a posterior cardinal vein, right posterior cardinal vein, but more of it is developed from the supracardinal vein only. In between the supracardinal vein and subcardinal vein, draw one small structure, that is the kidney. Actually, the right kidney has a short course that has to directly join to the inferior vena cava, and this is the mesonephric vein. Okay, right mesonephric vein. But left side develops from left mesonephric vein and the intersubcardinal vein then joins to the inferior vena cava. Okay, and this is the adrenal gland, that is a suprarenal gland. It is formed by the cranial part of the cardinal vein. Whereas caudal part of the subcardinal vein goes and develops into the gonadal vein. This is the caudal part of the subcardinal vein. Whereas cranial part develops into the suprarenal vein. Suprarenal vein. Okay. Anything is left out? I think everything I have covered. Only this much you have to learn. See, right brachiocephalic vein is from and right anterior cardinal vein. Correct. Left brachiocephalic vein is from left anterior cardinal vein and oblique anastomosis. Correct. Next, superior vena cava is from this L structure, that is right anterior cardinal vein and right common cardinal vein. Correct. Inferior vena cava is from posterior cardinal vein, right posterior cardinal vein, then superior cardinal vein. Next, anastomosis, and next anastomosis with what? It is a subcardinal vein. Right renal vein is from right mesonephric vein. This is a small one. This is the right mesonephric vein. But left side is very long. That is left mesonephric vein and intercardinal vein. Next, seventh one is gonadal vein. That is from the caudal part of the subcardinal vein. Whereas adrenal or suprarenal vein is from cranial part of the subcardinal vein, whereas azygous is by right supracardinal vein more than the right posterior cardinal vein. Okay, so here now you can answer, isn't it? This is the azygous vein. It is from common cardinal vein. No, what develops from the common cardinal vein? The right common cardinal vein gives rise to the superior vena cava, and anterior cardinal vein, yes, it also gives to the superior vena cava and also for the right brachiocephalic vein. Yes, and also left brachiocephalic vein also little bit. Next, supracardinal vein. Yes, correct. Subcardinal vein. Subcardinal vein joins with the caudal part is for gonadal and cranial part is for suprarenal, and it also anastomosis with the supracardinal vein for inferior vena cava. But here the more is for the azygous vein, so answer is C, that is supracardinal vein. Okay.